We've now delivered nearly 1 million jabs in the city, which is absolutely fantastic. And in the last 4 weeks alone, we delivered over 100,000 doses of the vaccine to our residents and also our registered patients in the city. So that's been absolutely phenomenal. I think the lessons learned are use the data and intelligence so you know where you need to target your energy. Look at access to vaccination centres. Don't assume if you set one up, that's it. You really must get out there into your communities and also use the communication, fantastic communication support we have in the city to get messages out in different languages. Really make sure you allow people time to make decisions. So there's always a good time to come forward, but if you're not quite ready and you need more answers to your questions, we've got clinicians on hand to help you. We've got our COVID helpline. So it's never too late to come forward. Always making sure we give people that time to ask those questions if they've got any concerns. And as I say, always making sure the access is there to get people to our vaccination centres, or in many instances to take the vaccinations to them, particularly with our housebound offer and other initiatives.
Vaccinations don't prevent all disease, but they prevent severe disease, and that's been evidenced by the data. What happens when you've been vaccinated? Yes, you might still get COVID, however you're less likely to be unwell, you're less likely to be hospitalised, and you're less likely to need intensive care support. And that means we can learn to live with COVID because it's a milder illness in those who are vaccinated. For those unvaccinated, I still worry because they're more likely to have that more severe disease that we saw in that first wave when we didn't have the tools like vaccination available to us. It's important for everyone to get vaccinated, but particularly for our ethnic minorities, because they are, if you look back to the first wave, we saw that there was a greater impact on people from an ethnic minority background who got more severe disease and unfortunately died. And we're still understanding the reasons why it affects some communities more than others. But in order to prevent that widening of health inequalities, I would like everyone from all backgrounds, but especially those more vulnerable, including our ethnic minority populations, to come forward and have that vaccination. It's never too late, and we are always happy to see anyone who comes forward at whatever stage, because we know it takes people time to understand. There's been so much information over the last year. It's been really difficult to balance everything in the media. So whenever you are ready for your first dose, if you've delayed your second dose, if you've delayed your booster, it is absolutely fine, and we want you and we will welcome you at any of our vaccination sites because we know that's the beginning of you getting protected.